Namaskar. You're watching Dr. KK Med Talks Fridays with Dr. Anita Kant, non-stop show 1154th episode. Let's have the headlines of the day. Women with common pregnancy complications are at an increased risk for cardiovascular and metabolic health problems later in their life. Recent data shows that approximately 1 in 7 pregnancies involve some form of heart related complication, including hypertension, heart failure, blood clots, or maternal death, even among women without prior heart disease. A new statement by the AHA underscores that mental health during and after pregnancy significantly impacts maternal cardiovascular health. A large new study has been found that women who experience any form of hypertensive disorders during pregnancy, even gestational hypertension, have significantly higher rates of heart attack, stroke, heart failure, and death within 5 years postpartum. A recent study found that heart attack rise amongst pregnant or postpartum women 35 to 39 years was 5 times greater than that of women in their 20s. So let's go to the topic of the day. जैसा कि आपने गेस कर ही लिया होगा कि आज हम बात करने वाले हैं हार्ट मैटर्स इन मदरहुड, मैनेजिंग प्रेगनेंसी विद कार्डिक रिस्क। सो जहाँ कहीं भी प्रेगनेंसी में प्रॉब्लम्स हो, उन सब से क्या हो सकता है मदर को, नॉट ओनली ड्यूरिंग प्रेगनेंसी, बेबी को भी उसके इल इफेक्ट्स होते हैं, एंड इवन देखा गया है कि आफ्टर डिलीवरी भी मदर को लॉन्ग टर्म और इवन फर्स्ट 5 इयर्स के अंदर इफेक्ट्स देखे गए हैं। तो इन सब के लिए बताने के लिए आज हमारे पास आई हैं प्रोफेसर डॉक्टर IB Vijayalakshmi. She is a distinguished cardiologist and one of India's most respected leaders in pediatric cardiac care. A professor emeritus and former head of Department of Pediatric Cardiology at Sri Jaydev Institute of Cardiovascular Sciences and Research, she has dedicated her career to advancing cardiac sciences, improving access to care for children with heart diseases, and mentoring generations of clinicians. As a past president of Indian Academy of Echocardiography, Dr. Vijayalakshmi has contributed extensively to the growth of echocardiography practice and training across the country. Her work continues to inspire excellence in clinical care, research and education. And मैं आपको एक खास बात बताना चाहूँगी कि when I finished my studies and I joined working as a obstetrician, we had not heard of a thing called fetal echocardiography, and today routinely it is being done during the pregnancy 6 months, so that we can know in advance कि अगर बेबी में कोई हार्ट की प्रॉब्लम होती है, warn the parents, and maybe if possible treat certain conditions also, all due to pediatric cardiologists like ma'am. And I'm so happy that she's here to answer some questions which we have gotten collected from our viewers and listeners. Shall we start, ma'am?
Yeah, sure. In fact, I started the fetal echocardiography in my state, Karnataka,
Yes,
and I
yes,
started teaching everyone. And the All India Radio, when they had interviewed, they got the best prize for that at the All India level for the fetal
yes.
echo. Then,
I remember this. That is why I especially mentioned when I passed out way back in 83, we had not
yeah,
known this word. And till a few years back, we were not doing routine fetal echo. It was a
correct.
thing, which had to be done in one of those super specialty hospital, and not even in our tertiary care hospital. Now it's a routine thing. Then go down, get it done. This is your
Correct.
time. So you have
Yes.
made a difference, definitely.
Thank you.
So, what are the early signs of heart problems that pregnant women should not ignore?
When a lady becomes pregnant, naturally she has to pump the blood, heart has to pump for her own self and also the baby, so the cardiac output increases and the hemodynamic changes occur because of the hormonal changes. So here progesterone and nitric oxide, they lead to the reduced resistance, vascular resistance. So the BP comes down, but the cardiac output increases because this is for well-being of the fetus. And if the resistance is more, the blood supply to the placenta will come down. When the peripheral resistance comes down, the blood supply is more. So the well-being of the fetus depends on these pregnancy changes, which are physiological. So that means it is meant for the good of the baby and also for the mother. But we have the pathological changes also. When a lady becomes pregnant, sometimes somewhere around 20 weeks or so, they develop preeclampsia and the blood pressure rises. So physiologically, blood pressure comes down, but here blood pressure rises. And as a result, the peripheral resistance increases and the blood supply to the placenta comes down. And that leads to the problem. So the first thing that a women should not neglect any symptoms that is there. So everybody, when they walk, they will become breathless. But if they become breathless, even for the short one, that the daily routine work, they must come to the doctor. If they have a palpitation, they must come to the doctor. If they have the breath, along with the breathlessness and palpitation, if they have the chest pain, they should never neglect it. And especially if they are breathless at rest and especially at night, what we call it as a paroxysmal nocturnal dyspnea, they should take it very seriously, because that is the one where the mitral stenosis or mitral regurgitation leads to that sort of paroxysmal nocturnal dyspnea. So that definitely indicates that there is a cardiac disease. And apart from that, easy fatigability is more. But one thing we must remember, pregnant ladies can be anemic, and the anemia will mimic all the cardiac symptoms. So first thing, we have to rule out anemia and see that she has to come to the doctor and examine properly.
Yes. So, pregnancy can increase the workload on the heart, and how?
Yeah, a pregnancy increases the workload because the volume increases, and the heart has to pump the blood for the pregnant lady as well as the fetus. So the fetus doesn't have its own blood, it has to go through the placenta, and that's how it is more in the during pregnancy, especially in the second trimester.
And does any pre-existing heart condition make pregnancy more risky for the lady?
Definitely, definitely. Because when already the because of pregnancy, the volume overload, heart rate, everything is more. And on top of that, if they have underlying heart disease, there will be some sort of restriction. And that's how we know, especially the pre-existing diseases like rheumatic heart disease, especially mitral stenosis and aortic stenosis. And apart from that, they can have a congenital heart disease like an atrial septal defect, ventricular septal defect, or they can have the pulmonary stenosis, congenital pulmonary stenosis, and all these things, they can add to the morbidity of the patient. And especially if they have pulmonary hypertension, that primary pulmonary hypertension or secondary pulmonary hypertension, or the Marfan syndrome, they can become very worse and they can have a catastrophic complications during the delivery. So all the underlying heart diseases have to be seen in advance.
So when you see in advance, you decide whether it is safe for women with that heart disease to plan a pregnancy.
Yeah, if the atrial septal defect is small, we say it is safe, but still not completely safe because paradoxical embolism can occur even through a small AST. And during the delivery, air embolism and the fat embolisms are very common, and the paradoxical embolism can occur. Ventricular septal defect is relatively safe, but what happens is if the infection occurs, bacterial endocarditis occurs, then that will be super added, and that bacterial endocarditis will cause heart failure. And if there is a mild pulmonary stenosis or mild mitral stenosis, mild atrial septal, aortic stenosis, these are relatively safe. but they have a tendency to develop bacterial endocarditis during the delivery. But if they have a severe pulmonary artery hypertension, any cyanotic congenital heart disease, that reduced saturation can lead to the fetal wastage. And that's how we know those are all contraindicated. And that's how we know one has to assess whether she's fit for surgery or not. And for this, the both mother's echocardiography and the child's echocardiography, fetus, both are very important.
So, what tests should be done besides echocardiography before planning a pregnancy if you have a heart condition?
Yeah. The first and the foremost thing is get a hemoglobin and a complete hemogram, because the bleeding tendencies are very common and anemia is also very common. And then, apart from that, a simple ECG has to be taken and the saturation oximetry has to be done. And then a detailed echocardiography has to be done. And unlike the other people, no, we don't send the patient for the X-ray, because the X-rays can damage the fetus. And that's how we know a detailed echocardiography, MO, 2D, and if required, even the 3D or 4D echo can be done to get the complete diagnosis. And now the 4D echo has come, which is almost like the surgeon looking into the heart, and that to the beating heart. And it is so beautiful. And that's how 4D echo also can be done, madam.
Okay. So that is a real great invention, I would
It's
say,
a
of
revolution
these
in
times.
yeah, investigation. Yeah.
Yeah. So, how does high blood pressure affect pregnancy and the health of the heart?
See, whenever the high blood pressure occurs, the radiovascular thing is jeopardized, and there is a proteinuria. The high proteinuria, the losing protein in the urine, causes the hyperproteinemia and the edema. And as it is in pregnant ladies, sometimes they have the swelling of the lower limb. On top of that, if they lose the protein, and that will be hazardous. And lack of protein will be, they come in the way of development of the fetus as well as this. So apart from that, because of the high BP, they'll have the headaches, and that will be annoying. And the blurred vision can be there, and they start seeing the spots. And the moment they start seeing the spots, they have to come, because it is very, very important that the blood pressure has to be controlled in time. And they can come with the breathlessness also. So, breathlessness, headache, and the blurring of the vision, proteinuria, edema, these are the basic signs and symptoms that we see when the BP is very high.
So, and what is preeclampsia? You just mentioned it, though it starts from the fifth
Yeah,
month
yeah,
onwards.
yeah.
And why is it dangerous for the heart?
Yeah. The preeclampsia is the one where, after 20 weeks of pregnancy, and if the blood pressure goes up, it is very important that that is the time we have to control. Otherwise, it has an impact on the fetus, and the child will be born with a prematurity. And the premature babies, they are prone for infection, their lungs are not mature, and then they have to be on ventilator, and it's a big problem for them. And intrauterine growth restriction is the major thing. And that's how we know the blood control is very important. Here I would like to give an incident where everybody, all the people taking care of the pregnant lady should remember. When I was a house surgeon in 1972, and one of our classmates, he used to play the cards the whole night. And in the morning, come pulse 80, BP 120, 80, CBS normal, RS, NAD, everything. And then the fetal heart sounds, you'd write and go. And whatever he has written, the PG would tell. Whatever PG tells, the assistant professor would tell. And one fine day, she developed convulsions, and then her sensorium was changed. And when I recorded the BP, it was 220 by 130. Oh my God, it was such a shock, man. See, one fellow being dishonest and not doing his work sincerely led to the loss of two lives. And that day I realized that every doctor, come what may, whatever they are, they have to be honest and sincere, especially with the pregnant ladies, because it is not the one life, it is two lives. And that's how we know recording the blood pressure is very, very important.
Right. So, can gestational diabetes also increase the cardiac risk in pregnancy?
Gestational diabetes.
Diabetes, yes, yes.
Yeah, gestational diabetes also is very, very important because this diabetes is the one, which causes the macrosomia. And apart from that, the fetus, can develop diabetes in the future. And the mother herself, though it is a glycosuria at that time, she can develop diabetes later. And diabetes is the always, it is a precursor for the coronary artery disease. And apart from that, most of them, they are obese. And the obesity and diabetes, it's a deadly combination. And with that, they'll have hypertension, high cholesterol, heart attack, and all those problems will be there. And that's how we know whether it is a diabetes or high blood pressure, whether it's a preeclampsia, whatever it is, we have to be very, very careful with the thing. And especially, the diabetic mother, if the glycosuria is not controlled, and if the diet and lifestyle is not managed properly, they can have a very big babies. Big babies means,
Yes.
I remember one lady brought the child and it looked like 3 months or 5 months. It was such a big one. Then I asked, how many months, kitna mahine ka hai? नहीं नहीं कल पैदा हुआ. I said, कल पैदा हुआ इतना बड़ा बेटा, it's such a big child. Then weight कितना है? 6.5 kilos. Oh, cesarean करें क्या? I asked. नहीं नहीं नहीं, नॉर्मल डिलीवरी हो क्या? अरे बाप रे, कैसा नॉर्मल डिलीवरी का? कैसे माँ इतना स्ट्रांग हो? नहीं नहीं, मुझे कुछ नहीं हुआ. वो नर्सेस और डॉक्टर्स थे ना, वो पुश करके पुर के वो थक गए और बेबी अच्छा आ गया, बिल्कुल अच्छा है. And absolutely no problem. I can't imagine only in a government hospital such a baby can be delivered normally, I thought. But of course, delivering the normal baby versus cesarean section, there are advantages and disadvantages. So,
Disadvantages.
but anyway, this is what happens if a mother's diabetes is not properly controlled. So, controlling the diabetes now and even afterwards, it is very important because almost 27 to 28% of them become type 2 diabetic in the future, and they are likely to have coronary artery disease and the heart disease, and even the baby can develop because of the it is used to the hyperglycemia. And then soon after coming the baby, the once it is born, it can go into hypoglycemia. So that is how we have to manage these diabetic mothers when they are pregnant, even after delivery, and the monitoring has to be done very well.
Yes, I agree with you because she was very lucky that she delivered normally. Yes, delivering normally is no problem, but sometimes the shoulders get caught, and
I know.
then a paralysis can result. So that is a very common thing with large babies of diabetic mothers. So how you were talking about anemia. So how does anemia impact the heart during pregnancy?
The anemia, already mother, because she's pregnant, there is a cardiac output is increased and the hypervolemia is there and the heart rate is more. And then when she becomes anemic, that is exaggerated. It is like putting the ghee into the fire. So it is doubly impact is there. And that's how their symptoms become exaggerated and then they have to come. And apart from that, the lack of hemoglobin can damage the fetus also. So they can even lose, if there is a severe anemia, they can lose the child. And that is the reason, it is extremely important that the anemia is detected in time and corrected in time.
So, is light to moderate exercise safe for pregnant women with heart disease?
No, 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 not at all, not at all. Because already the heart is overburdened. On top of that, it has got a underlying heart disease, and even the slightest exercise they can tilt the balance, and they whatever they are in the precarious condition, and they can go into heart failure. And that's how except the daily routine, they should not do anything, and that's how any sort of exercise is not safe. But otherwise they can do the yoga and other things, then that is okay. But yoga means not exercise or the asanas, and just breathing exercise and meditation and shavasana can be done. Otherwise, no exercise.
And any other lifestyle factors that they can change to feel better during pregnancy?
Very, very important. You have asked the very pertinent and very important one, because nowadays, the in the olden days, the mothers, grandmothers, they used to take care and they used to tend. But now, single, what to say, nuclear family, nobody to take care of the pregnant lady. And then, they are eating junk food, and then obesity and increasing, and the depression is there, and as it is the workload, and they are working from home or working elsewhere. And then this is a very, very tricky situation, and they have to realize how a woman being a mother is a divine gift, and they should not ruin it by their bad habits. And especially nowadays, the girls have started smoking, drinking, taking drugs. And Dr. Anita ji, with the great regret, I have to tell, our in Bangalore, the Nimhans, it's a first center in the whole country to have a female de-addiction center, and
Yes.
that is a tragedy. And when I went there, because I'm a crusader against alcohol and tobacco and drugs, when I went there, the beds are not enough, the overflowing. So that is the very tragic thing. And especially after the corona, the bad habits have increased both in men and women, and especially women, it is more harmful, because when they smoke, there is a Baltimore study which says that the right-sided heart disease in the fetus are more when they smoke, and when the alcohol is taken, the ventricular septal defect is more. And apart
True.
from that, the transposition of great arteries are more. And more than that, fetal alcoholic syndrome, the brain is also damaged, the face is ugly, and they become criminal. And that's how we know these things, scientifically, it has been proved that these should be totally avoided. And the drugs, of course, it is like inviting the death, both for the mother as well as the fetus, and that's how they have to be listening. And apart from that, in the lifestyle, they have to keep a watch on their weight. Of course, any pregnant lady, she is bound to increase her weight, and that has to be according to the gestation. But if they are overweight, the delivery also becomes difficult, and they can become diabetics, and they can become hypertensive. And more than that, they developing coronary artery disease, and the fetus developing coronary artery disease in the future are more. And that's how obesity is the mother of 5 deadly diseases, and that is the diabetes, high blood pressure, high cholesterol, heart attack, and then the Alzheimer's disease, provided they survive. And that's how one has to take care of their lifestyle and what they're eating. And that is very important. Sattvic ahar, small quantities, more frequently, because as it is, gravid uterus, it is pressing on the stomach, and then there
Yes.
will be belching. And if they overeat and if they are eating the spicy food, the burning sensation will be there, and they won't know whether that burning sensation is because of the gastric problem or it is because of the cardiac problem. Because I have seen young women coming with a heart attack during the pregnancy, and they can come with the Takatsubo syndrome. That is
Yes.
over stress, the suddenly ballooning of the heart occurs, and then the ejection fraction comes down to 10-15%. And this is also because of the stress. And people, nowadays, when they are alone, they are scared, they are worried what is going to happen, the anxiety is there. And then, apart from the hormonal problem, the disharmony in the family also causes the lots of problems nowadays. And hence, the lifestyle is very, very important. They have to be smiling, happy, and then, like you are giving smile, they have to be contented. And then, more than that, eat small quantities and lots of vegetables and the fruits, and especially the banana, because the banana, prevents the constipation, because constipation is very common among the pregnant women. And then, depression is also, stress is more common. And banana contains serotonin, so it is an antidepressant. And then they can have a hyperacidity, and this banana contains pectin, which neutralizes. And that's how, eating the fruits containing antioxidants, and so that all the blood vessels, endothelium is fine, and their clotting mechanism is better. And the fruits, they prevent the hypercoagulability or this thing, they normalize the clotting phenomena. And that's how, the healing also is much better when the fruits are taken. And that's how any pregnant woman should take more fruits, more vegetables, and more home cooked food rather than the junk food from outside, because the junk food contains no nutrition, no fiber, and absolutely there is a preservative, more salt, and all these things can damage not only her, even the baby's heart and the baby. And that's how we know that lifestyle changes are extremely important in a pregnant lady.
And what daily symptoms should prompt immediate medical attention?
Yeah, this is very important, because the symptoms in a pregnant lady, breathlessness or easy, fatigability are common. But if they have occurred very suddenly in the recent, and if it is associated with the chest pain and palpitation, and if there is a nocturnal dyspnea, she's sleeping well and suddenly she gets up with the choking sensation and breathlessness, and that, she should come immediately. And sometimes they can have a delirium and fainting, and sometimes they will be coughing out blood. For example, I'll tell you, a lady, she didn't know she had an underlying heart disease, and daily she was coughing out half a liter of blood, and she was brought in a very severe condition. And that too, hypertension was there. And then we did the echo, there was a pinpoint mitral stenosis, just zero point 0.4 square centimeters, zero point 0.4.
Mm-hmm.
That means just
Mm-hmm.
4 millimeter. And
Mm-hmm.
there was a pulmonary apoplexy, and then she was coughing out blood. So we took for the emergency balloon dilatation, opened up, and then, but the next day she had a normal delivery. And she was sitting, when I went to see her, she was sweating, exhausted, but she was alive. And I was very happy. Otherwise, what would have happened? She would have died if she had to come in time, and if she had to do the emergency balloon dilatation. And then the ignorant people would have blamed the baby. Oh, it swallowed the mother and the mother died. It's a panote hai, it is
Mm-hmm.
not auspicious or not good luck, See, that sort of things should go off. And now the advanced technology is so much, we can do anything if they come in time. And that's how we know any symptoms which is more than normal, they have to come to the doctor immediately and they have to be treated.
Now, there's a question, can pregnancy related swelling be a sign of heart failure?
No. Sometimes what happens is just mild edema because of pregnancy, it is not because of the heart. But suppose the edema has occurred very rapidly and it is more puffiness of the face is there, and this is a more of a dependent edema, and that indicate that the patient has got an underlying heart disease. And especially if she has got a palpitation, chest pain, and all those PND, paroxysmal nocturnal dyspnea, All those things have to be underlined, and that is very important. Yeah.
We have learned so much, and we are running out of time. But before we
Yeah, yeah.
finish, I want to
One more,
ask. Yeah.
one more thing I would like to
Yeah.
tell, whenever
Mm-hmm.
the pregnant lady comes for the delivery and the
Mm-hmm.
anesthetist, they send for the fitness. So one of the patient who was achondroplasia, very short
Mm-hmm.
lady, and normally delivery was impossible. So the anesthetist, they wanted the cardiac fitness because she had a murmur, the ejection systolic murmur conducted to the carotid. And when I did the echo, to my utter shock, her gradient across the aortic valve was 178.
My
And
God.
I don't know how she had come to the final, that is the third trimester. And then,
Miracle.
yeah, and she was very poor. And Dr. Sunanda Kulkarni, my friend and obstetrician who had referred, both of us, we donated money. I did the emergency balloon dilatation. From 178, it came to 40. Then I gave the fitness for surgery. The same evening, she was shifted to Vani Villas, and then they did the cesarean section. And after 1 week, she came with a beautiful baby. And I
My
was
God.
happy. Sunanda Kulkarni was happy. Everybody was happy. And then, she never came back for the follow up. She never came back. I kept on asking Sunanda, did she come? And she was asking me, did she come? So she didn't come to us. After 1.5 years, she came to Sunanda when she was pregnant again.
Oh
So
my
this is
God.
the, yeah. So this is the level of our people. So we obstetricians or gynecologists or multi-speciality, all of us, we have to work like a hand and glove, like a
Handle.
team.
Yes.
It is a
Yes.
teamwork to win and to save two lives.
Yes. Multidisciplinary team is required. Can breastfeeding impact heart condition?
Can
Breastfeeding impact the heart condition?
In fact, the breastfeeding is very, very important. It is a boon both to the mother as well as the child. The child gets the good nutrition, good immunity, good development, and everything that is required. And the mother, she developing ovarian cancer or the breast cancer comes down considerably. And apart from that, she will have what to say, the because of the feeding amenorrhea, she becoming pregnant also comes down. And it is proved scientifically, any woman who feeds the baby breastfeeding, she developing cardiovascular disease comes down considerably. So that means if they want the mother and the baby to be healthy, so don't go for the top feeding, go for the breastfeeding, and that is the nectar. Very
Great,
essential.
great, great. So thank you, Professor Dr. IB Vijayalakshmi, for joining us today. Could you show us the certificate, please?
Yeah.
This is a small token of thanks. It's a real honor to have you here as a distinguished speaker.
Thank you.
Thank you
Thank you.
so much. That will be all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Thank you. Thank you so much. Shubharatri.
Shubhratri.